Hello again. Uh, for now, I'm going to explain about uh, the disease called the avian encephalomyelitis. Yeah, the abbreviations of avian encephalomyelitis is AE, and these cases also can be called as epidemic tremor. Why epidemic tremor happens? Because tremor will easily spread to populations of the chicken, okay, and most of the chicken will be affected. It's just like tremor, but the tremor can be transmitted from one chicken to another, okay. This is quite important diseases in chicken, and it usually cause disease in very early age of chicken. Right. So the avian encephalomyelitis. Encephalo means brain. If there is the word myelo means marrow. No, sorry. If there is word myelo means marrow. In this case, the marrow means the spinal cord. So these cases of disease causing uh, inflammations in the brain and spinal cord. The cause of this disease is a picoRNA virus, picoRNA virus. Okay, and this is the clinical symptoms of the chicken affected with avian encephalomyelitis or AE. There will be paralysis, and the paralysis occur in very or early a young chicken age. The transmission can be vertical, means from hen to the day-old chick, so it transmitted through the ovary, or also horizontal between direct or indirect, in particular by the contaminated feces. The major or the most typical transmissions of this disease is due to egg transmission. It means the vertical route, and the infected chicken breeders, I mean the infected hen, can transmit the viruses for several weeks, and it makes also decrease in egg hatchability, so the egg is not hatched well. And then the infected chick will show clinical signs, in particular paralysis, and it causes also the infection to spread and causing most of the day-old chick become infected. However, the chicks also can be infected without any clinical signs, and the incubation period is very short. It's around 5 to 14 days. It means around 1 2 weeks or 2 weeks for the incubations. And it means because the day old chick already affected, so the transmission the already started from early age, because it transmitted from the infected infected breeders from the hen directly to the ovary, and makes the uh, ovary of the chicken already contain virus. Okay, this is the cycle of avian encephalomyelitis in chicken. So usually for healthy chicken, the hen is vaccinated 4 weeks before the eggs productions. Therefore, the chick will be free from the disease. However, the hatch chick will free from the disease. However, if they become infected after hatch, it should be the transmission due to horizontal transmission. However, the roots too, it means from the uh, vertical transmissions, it infects the ovaries, So if the picoRNA virus already infect the ovaries, it makes the drop in egg productions. However, some of the eggs that can hatch, it will show the day old chick will show clinical signs around 3 to 4 weeks of age after hatching. And the signs begins its very early age, from 1 to 6 days of age. Okay, and it can be progressed into 4 weeks, but the chicken usually died easily due to dehydrations because they cannot take the feed and drinks properly. So mainly seen in young chicks, mostly in the 1 and 3 weeks of age, but from 1 day the clinical signs already appear. Okay, paralysis occurs, in particular it causes tremor, okay, and paralysis in the leg. And the mortality is high, can be until 75% and even close to 100%. Here, this is the neurological sign in chicken affected by AE. And you see the paralysis here. The chicken cannot stand properly because there's damage in the brain and also spinal cord. Torticollis can be seen, okay, in coordination. Torticollis, hawks sitting like this, okay, because they cannot stand properly because damage in the spinal cord and brain. And malacia will occur. So just like I said maybe in the previous lecture, that malacia is due to damage in the nerve fibers in the brain or spinal cord. Can you see here, this is the normal chicken. We cut the chicken head in half so we can see the shape of the brain here. This is the cerebellum, sorry, this is the cerebrum, and this is the cerebellum. It's normal. Okay, formations of cerebrum and cerebellum, and the border between cerebrum and cerebellum can easily seen. However, in here, damage of the brain in the case of avian encephalomyelitis can be seen. This is extensive damage in the cerebrum and also in the cerebellum. It makes the brain size become smaller. And in the embryo that affect by avian encephalomyelitis by AE, this is the normal fetus, the normal embryo here. Okay, the shape of the skull, the head skull is normal without any abnormalities in the neck here. But however, there will be swollen area close to the neck, just behind the head here. This is due to herniated of the foramen magnum. Maybe it's due to inflammations in the cerebellum and also inflammations in the spinal cord in this area. So the typical clinical findings here, this one here, the ataxia means they cannot move easily in coordinations on moving, and also lens opacity due to optical nerve damage, and decreased egg production and hatchetability usually seen in the breeder. Okay, and in the newly hatched chicks there will be tremors of the head and neck. Okay, and the typical findings when we do the necropsy is, besides on the brain, mostly besides brain we cannot find any findings in the organs. However, some whitish areas in the ventriculus muscles due to infiltrating lymphocytes due to inflammations in the ventriculus can be seen, but it's not always or not consistently found. And infections occurs in the age around 30 days. Okay, and it causes also sudden drop in the egg productions, and then the egg production will be slowly increase again. This is not specific, but if we see a sudden decrease of egg production, in particular around the 30 weeks old chicken, and then it's increase slowly and return back to normal, might be due to the AE, but most of these phenomena cannot be seen properly. Okay. Diagnosis mostly from the clinical signs and of course also from pathology. And the chicken, the gross lesion is mainly located in the brain and spinal cord, with in some cases can be seen also in the proventriculus, gizzard, and pancreas. But in the proventriculus, gizzard, and pancreas is not consistently occur. Therefore, we seen in particular in the brain and spinal cord. And then the chicken that survive from the infections in the early age, they may develop cataracts and muscular necrosis in the later age. And the microscopic lesion, yeah, it's not so obvious, in particular in the infected adults. And in adult birds, the avian encephalomyelitis will cause a cataract here. This is the normal eye. This is eye with cataract. Okay, here, eye with cataract due to the AE virus. So between adult and day old chick, the symptoms that appear is different. Okay, mostly are subclinical in adult, with some exception on the eye, for examples. Okay, however, in the young chicks, uh, clinical symptoms, for examples, the tremor is seen, is easily seen. Okay, here this is in adult chicken with ventriculitis, focus of ventriculitis, and inflammations in the ventriculus. And if we look this white spot and we look by using histopathology, we will see a nodules of lymphocytes in the wall of the proventriculus and sometimes also within the heart, but this is seldom found. Or increased number and size of lymphoid follicles in pancreas. These cases can be found mostly here in the in these visceral organs, mostly in the adult chicken, not in the young in young or day old chicken. Here, lymphoid lymphocyte infiltrations in the heart muscle and also in the ventriculus. Sorry, in the muscle of the proventriculus. Okay, this is not specific. Okay, therefore, we have to apply more details, and we have to use some other methods to investigate and to specifically diagnose this disease, for example using PCR or immunochemistry, because this histopathology here, the dense lymphoid aggregates, is not specific. Here this is also lymphocyte cell aggregates, lymphocyte cells accumulation in the muscle of the ventriculus, and also it can be developed into inflammations of the muscles or myositis. This is occur in gizzard. And increase size of lymphoid follicles in the pancreas. Here, increase size of uh, lymphoid follicles, follicles that compose of lymphocytes in the pancreas. Similar changes that we see also in the proventriculus. However, the pathognomonic lesion is the damage in the brain, and this is exclusively found only in young chicken. Okay, 1 to 6 days already appeared the clinical symptoms, and it can last until 4 weeks old. Uh, what we can find is necrosis of the neuron called the central chromatolysis. In particular, can be seen in the brainstem, in the medulla oblongata, just between the area, just between the cerebellum and cerebrum. Okay, and there will be also encephalitis that characterized by infiltrations of lymphocytes in the virtual Robin space or around the blood vessels. And if necrosis already occur and malacia also can be found, in the part with malacia there will be also formations of glial cells, or we call it as gliosis. And damage in the blood vessels, damage in the brain, can be seen also in the nerve cells, for example, in the Purkinje cells in the cerebellum. Here, this is the necrosis, a typical necrosis in the case of AE and Avian Encephalomyelitis that we call as central chromatolysis. Chromatolysis occur in the nucleus, makes a eosinophilic or pinkish areas within the cytoplasm, and the remnants of the nucleus will be located in the peripheral part. This is typical finding in cases of avian encephalomyelitis. Here, if we found the animals in very young age has a paralysis, tremor, and then we take samples, and if we look in the brain, there is a central chromatolysis that found inside the nerve. This is typical findings of uh, avian encephalomyelitis of AE. Okay, and encephalitis can be seen also by formations of perivascular caving. It means that the dense lymphoid cells will be seen around the blood vessels, and it's developed into malacia. Can you see vacuoles in brain like this? This is the malacia, and the malacia, the area of malacia will be occupied by glial cells, causing gliosis. Okay, gliosis. Here also gliosis. This occurs in the cerebellum. And if we see the nerve cells, the neuron, it has the neuron necrosis that we called as the central chromatolysis. That's typical findings in cases of avian encephalomyelitis of AE. So the diagnosis by using viral isolations, but usually we do viral isolations if we found the disease, okay, if we found or we suspect the disease through the clinical and pathological examinations. And surveillance of these cases, in particular in the affected farm, can be seen also by using ELISA testing from the blood serum of the breeder flocks. Okay, and to isolate the virus can be isolated by the inoculation in the embryonated specific pathogenic free or SPFX, just like we make isolation for the case of Newcastle disease or avian influenza. This is abnormalities of embryo. This is the normal embryo. This is embryo with avian encephalomyelitis. Small size of embryo, and can you see reddish area around the eye caused by hemorrhages in the eye and also in the brain. And in cases of avian encephalomyelitis causing hemorrhages here in the uh, cerebellum, okay, and sometimes it's a bit difficult to differentiate this with another form of uh, brain damage in young chicks, like for example avian encephalomalacia due to vitamin E deficiency, Newcastle disease, or Marek. However, Newcastle disease and Marek, they do not cause disease in very young age. Okay, and vitamin E deficiency B1 or B2 in the real life, we never found this disease, except this disease can be made experimentally. Okay, so for treatment and control, vaccine is very important, and the vaccine can be applied at 10 to 14 weeks period. It means around 3 or 4 weeks before the chicken start to produce eggs. And the vaccines can be applied through drinking water or can be combined with the vaccinations of avian pox, for example, by using avian pox and AE vaccine through the intradermal or wing web stab. Okay. Uh, Care should be taken to avoid introducing AE vaccine into multi-age breeder farms. So because this is a live viruses, live attenuated vaccine, and there is some worry that the vaccine can develop into virulent virus. Therefore, the chicken should be vaccinated uh, after 15 weeks of age. So it's around 13 or 14 weeks. It's already vaccinated before, because it must be done to prevent shedding of the virus for at least 4 weeks following vaccination. Okay, if the breeder flock of the vaccinated against uh, using avian encephalomyelitis already vaccinated, but outbreak still occurs, we have to stop the vaccination first. Okay, and then we have to make further investigation, and we clean the flock thoroughly. Okay, and then we have to check the breeders whether they are still positive or not with the AE virus. Okay, this is some of the references that we use for this disease. Not so complicated for this disease. So in conclusions, this AE virus mostly affected the young age chicken, even from the very early age, is due to the vertical transmission nature of this disease. And in adult chicken, it shows a yes, non-specific signs, with some exception in cases of cataracts in adult chicken, but that's rarely found. And vaccinations can be applied to prevent this disease. However, the vaccinations can be performed just before about 4 weeks before the chicken produce eggs, to avoid the virus shedding to the environment following the vaccinations. So that's all from me about the avian encephalomyelitis. If you have any comments or questions, please don't hesitate to ask me. Good luck to you all. Have a nice day.